Hello and welcome to Food Safety Fridays. My name is Simon Timperley from the International Food Safety and Quality Network. Today's subject is validation and verification, ensuring compliance and excellence. And today's guest presenter is Harmeet Dosanjh, Director, Training Food and Agriculture Division at SCS Global Services, Inc. Welcome, Harmeet. Happy Friday.
Good morning, everyone, and yes, happy Friday. Thank you for having me here again. And it's 7 a.m. in California.
7 a.m. in California, and it's 3 p.m. in UK, sunny Manchester. Tell us where you're joining from, wherever you are in the world. We bring you all together for this 1 hour of exceptional training with great presenters every week. So I'm going to play the sponsors ads now, and we'll be back in a couple of minutes for Harmeet's presentation. Okay, thanks to the sponsors. I'll be back for the Q&A later, but for now, I'll hand you over to Harmeet for the presentation.
Thank you, Simon. All right, again, good morning, everyone. Thanks for joining from all over the world today. Really excited to be here, and let's talk about validation and verification. I am Harmeet Dosanjh. I'm the Director of Operations in SCS Global Services. I have 15 years plus experience in food industry. I have Masters in Food Safety from Michigan State, and I did a certificate in International Food Law and Regulations, where I studied the laws. And I'm excited to discuss here what exactly validation and verification is. So let's dive into this. But before that, a little bit about SCS Global Services. It's an international leader in third-party safety, environmental, sustainability certification, as well as standards development. We specialize in auditing, certification, verification, lifecycle assessment, and strategic consulting. We do provide the trainings. These are the services we provide, which is again training. We have consulting. We have audits, BRCGS, Global Gap, GMP, SPF. And our experienced trainer provide education knowledge based on experience. All our training has credentials, and we do provide training presented here. And also we do provide instructor-led online, which is self-paced and classroom. And then we have food labeling and sustainable agriculture as well, in which we have fair trade, rainforest alliance, and SMETA, and sustainably grown. Key discussions points here. We're going to be discussing today what's the exact difference between the validation and verification, critical role of validation and verification in the food industry, um, emphasizing their significance in ensuring quality, regulatory compliance, and how a robust validation verification is essential for maintaining customer trust. Simon, can you hear me?
Yes.
Okay. I just want to make sure because in the chat box it shows that audio is not clear, so I want to make sure.
Yeah, you're coming through loud and clear. It could be just a.
All right, just wanted to make sure. Thank you. And how robust validation verification process is essential for maintaining customer trust, upholding the industry standards. So here's a poll question. How about you guys? Please type on in the chat box. What is your biggest challenge in effectively implementing validation and verification activities? Is it finding time to perform them? Is it gaining team support? Is it knowledge of how to conduct? Limited resources, no issues or unsure. So please take a moment and please type in the chat box. What is your biggest challenge in effectively implementing validation and verification? All right, most of you said knowledge, you said time, uh, again, getting team support, finding a team, no issues, it's a good thing, and knowledge to conduct. All right, seems like majority of us are leaning towards knowledge on how to conduct even validation, how to conduct verification activities, and most of you mentioned it will be getting team support, no issues at all, which is really good when we talk about validation and verification. The FDA definition on validation and verification is this: validation is obtaining and evaluating scientific and technical evidence that a control measure, combination of control measures, or the food safety plan as a whole, when properly implemented, is capable of effectively controlling the identified hazards. Verification, on the other side, is application of methods, procedures, tests, and other evaluations in addition to monitoring to determine whether a control measure or combination of control measure or it has been operating as intended, and to establish the validity of the food safety plan. If we look into Codex definition, Codex Alimentarius definition is about validation is collecting, evaluating the scientific technical information to determine if has food safety or your quality plan when you properly implement is actually effectively controlling the hazard. And then verification is about those activities other than monitoring that determine the validity of hazard safety, food safety plan, and ensuring that the system and control measure is operating as intended. So in other words, validation, are we measuring the right thing? Will it work? Okay, that's validation. Validation is actually the proof that the plan is working and will be effective. Validation takes place before verification. Validation demonstrates that the system works to control the identified significant hazard. Validation is performed by a qualified individual.
Harmy, can I just stop you just there for? Sorry about it. Have you got your voice is a bit echoey. I don't know if you're just using your laptop or whatever. Have you got an option to plug in any headphones or be closer to the microphone or something like that?
I am using the headphones.
We've got a bit of echo, that's all, and one or two people have said it's not as clear as it could be. Maybe don't know if you can do anything.
How about now?
You can try it. See if it improves it.
Is this clear?
It's clear for me. Yeah.
No, it hasn't. Is this clear now?
It, it, well, try the slide again and see how it goes.
All right. Types of validation. Can you hear now? Better, a little better. Okay.
Yeah.
Maybe I can. Okay. Can you guys hear now? Better now?
It's a little better. Yeah.
Yeah, I'm not sure, but
It's not perfect, but it's better. So if people can follow along with the slide text and listen to your voice, then we'll make it work.
thank you. All right. So seems like a lot of people are saying it's better, so that's good. I can maybe increase a little bit more the voice and see. All right. So we were just talking about the validations. So these are the type of validations, meaning food safety, we're doing testing, formulation. So when we're talking about initial validation of any food safety plan and system requires scientific and technical backing that it was designed to work and the facility can implement to make it work. So when we talk about food safety, we talk about critical limits. We are looking at GMPs, established GMPs are fit for purpose. We're talking about hygienic design, is it PPE included, procedures and processes. And when we talking about programs based on your food safety plan, suggest requirements such as allergen or supplier approval, what is required if you have a third party audit. Okay? So these are the type of validations we are looking when we talk about food safety. We talk about it could be quality plan as well. Verification, on the other hand, in the other words, are we doing what we are supposed to be doing? Is it working? Verification is proof the plan is being followed as documented. Verification takes place after validation. Verification is pre-planned and scheduled, and it is performed by qualified trained individuals. That is going to be the verification. Now, what are the tools available for actually verification? When we're doing verification, it could be record review, it could be calibrations, it could be inspection and testing, visual observations, internal audits, CCPs beyond monitoring, could be product specifications, environmental monitoring. Those are the verification tools that is available, and you basically decide based on what kind of verification you're doing, what tool will decide to do the verifications. The process of validation and verification. Many organizations use validation and verification process, meaning coding, designing, and devising, building systems. So when we talk about validation and verification, we start with initial validation. Initial validation relies heavily on your scientific, regulatory, and industry information. What control measures have been shown to be effective in the industry under similar conditions? If no data, meaning new product validation of controls should be part of your research and development R&D, and then moves on the ongoing verification, which rely on your data generated by your facility. So if deviation occurs, corrective actions may require revalidation, meaning reassessing your design, or it could be further controls in how program or processes are working. Lastly, you're doing the annual reassessment, looking at the trends, looking at the data to determine if things are working and conducted further validation. Although FDA requires every 3 years, but if you are into GFSI benchmark standard schemes, SGF, BSCGS, you probably all know that it requires even broader requirements, what needs to be verified and validated beyond just the food safety plan. They require GMPs confirmed to ensure they achieve the required results, changes to the processes, procedures are confirmed to be controlled are still effective, along with your regulatory requirements such as label claim, traceability. So all these programs must be identified on a schedule based on your risk, frequency, and how are you going to be achieving these. So required GMPs confirm to ensure they achieve the required results, changes to process confirm to be controlled are still effective, along with the regulatory requirements such as, again, how you're going to be achieving these is based on risk. What is your frequency going to look like? And this is how we talk about initial, we're talking about ongoing, we're looking at corrective action if there's a deviations going, and then we're doing annual reassessments. What other tools are there to derive compliance and reduce the risk? And the tools, selection of validation methods. There are many methods out there. Each facility look into their own specific method to where they select for the validation. So it could be third-party accreditation lab, scientific literature. You're looking at regulations, you're looking at guidance documentations, you're looking at peer-reviewed journals, you're looking at process authorities, allergen analyzer testing, AOAC, initial calibration of your equipment, and then you're also looking at your operational data, which is your in-plant observations, experiments, testing, and analysis. So when we are establishing document evidence that provide a high degree of assurance that a specific process or system will consistently produce a product meeting its predetermined specifications and quality attributes. For example, when I was part of quality insurance department, we did validate our roasting for 5-log reduction. So in that scenario, we were looking at scientific literature. We did in-house validation studies, which we call it challenge studies. We did some, we generated the data, and after that, we decided, okay, what will the right temperature, what will the right time is going to be, where we basically know that yes, it has reached the 5-log reduction, and based on that, we did the verifications. So what are the resources out there for validation? For example, like I said, for fisheries and fish guidance, there's a PMO for pasteurized milk ordinance, and you're looking at for growth of food-borne pathogens during refrigeration. So again, regulatory time parameters, guidance, widely used such as your FM and Tompkins study, scientific literature, peer-reviewed journals, all are the resources available out there which you can use as a guidance. When I was in the almond industry, we had our Almond Board of California, and we used the Almond Board studies, basically validation studies, to mimic for the roasting process. So that's how we did validation of our roasting. Selection of your verification methods. Now, when we're talking about selection of verification, how to select the right verification tool? You can consult the experts. You can look at process of selecting the right verification tool, ensuring careful evaluation, possible outside technical support could be. It could be the International Commission on Microbial Specifications. Maybe there's a certain sampling techniques, amounts are important, type, product, processes. So how do you select? It could be, like I said, industry best practices, internal audits, third-party provider. Those are the selection of verification methods out there. Initial verification, again, for example, HACCP plan requires establishing verification procedures. How do you know if you have developed the right method? Later, we look at best practices when we're doing formal assessment activity. Are employees properly trained and knowledgeable? So you're looking at initial verification, you're looking at ongoing verification, and initial is this, will the identified critical limit be different than operating? Is the limit process capable of being achieved and measured? Are the right tools selected? Does the monitoring record fully document? And in the ongoing verification, are the limits being consistently achieved? Does the record reflect compliance? Has the process, equipment, type of product changed? When deviations occur, has a thorough root cause analysis, and is it being conducted and the change has been implemented? So when you develop your risk-based plan, think about this. Develop, implement, maintain validation and verification schedule, and come up with these SMART goals. What activity are going to be conducted? What is the purpose? How? What is the method are we going to use? And what is the right approach for this? When? Frequency in which it will be conducted. Who is responsible for doing this task? Who is accountable for this? Create and continually monitor success of the plan by setting the SMART goals. SMART is specific, measurable, achievable, realistic, and timely. And adjust if issues determine an increased frequency or change in method is needed. So ensure to follow the scheduled plan, but also make adjustments if issues determine increased frequency or change in method. Verification program. Internal audits. Internal audit plays a very important role. The role of independent audit is to provide independent assurance that your organization's risk management, governance, risk control process are operating effectively. So when we talk about internal audits, we all know, we plan it, we talk about audits should be independent. Um, Documented assessment, we're looking at whether agreed requirements are being met. Food industry relies on audit function to provide safe food to their customers, ensuring that processes are working and when actions can be taken before a significant deviation occurs. So internal audits are designed also to identify continuous improvement opportunities, validity of your food safety system, scheduling. Scheduling is also another one where we, based on importance, risk, duration and frequency, based on your complexity, risk significance, ensure your auditor is independent of the area being audited and you're reviewing the findings with the leadership team and develop different approaches and make sure that internal audit program is fully implemented, fully documented, and it's actually working. Majority of the time, internal audit is one area where many companies receive as a non-conformance because internal audit program was not developed properly. It wasn't scheduled, is not there, the auditors are not trained. So make sure that our internal audit, which is again your verification program, you go out there, you do the audits to make sure everything's working as per your plan. So please, one area is this internal audit is telling you a lot. You're looking at gap assessments here. It's not a blame game. You are basically trying to help each other to do better and make sure that we are improving our systems. Food safety plan reassessment. So objective of this reassessment is to determine if the system is effective and functioning as intended. Okay, when we are identifying our food safety hazards, we are looking at record review of critical limits, new industry information, what are identified hazards going. Customer complaints are also driving a lot of data, a lot of it's already telling you some story that if particular customer complaint is coming every week, every month, 6 months. It is already telling you that your systems are not functioning and it could be that there is going to be a breakdown. Okay. The number of holds do you have, how many type of deviations you receive, what kind of deviations are we getting, determine if revalidation is required. And of course, you all gonna back up all through the documents, through the records. So it's very important when you're looking at the reassessment, looking at, okay, if the current critical limits are functioning, is it still working? Okay, is the current validation is working. This is another area where I have seen, and I'm pretty sure most of you probably have observed, where when the new product comes in, when we are coming up with the new lines, and we sometimes forget to see, okay, let's look at our hazard analysis, let's look at our food safety plan. Are the current controls are still going to work? Are the critical limits are still going to be there? Are going to be working for this new product, new line? And sometimes we just miss that, and now you are in a recall situation, you are in a very high customer complaint scenarios because we just did not pay attention in a way. We did not take a look at, okay, let's look and let's see, we need to reassess our hazard plan. Are those current validations still working? And if not, then let's go back and revalidate. Verification of allergen controls. As you probably also most of you are aware that in US, for example, the leading cause of recall is allergen being misplaced. Okay, allergens are missing on the labels, it's mislabeled, and that's the leading cause why we have so many recalls. So when we talk about verification of allergen control, allergen recall prevention is the key for creating more than one monitoring point, but multiple verification controls can be effective. For example, record keeping, right? Record verification checks that are timely and by different individuals to stop non-conforming products being released. Employees are not allowed to retrieve their own labels. Labels are not returned to stock without reconciliation. Lock storage and handling of certain high-risk allergens, for example, nuts. Evaluation of your frequency, every roll of film case instead of every hour, and technology control, scheduling, barcode scanners. So these are the verifications for the allergen control. But again, in this section or in this scenario also, where we basically, again, leading cause of the recall is mislabeling, labels were inaccurate, wrong labels were misplaced, and many times it happens because it could be oversight, we didn't pay attention, we just finished one batch and we didn't actually clear the lines, right? So a lot of things can go wrong, and it could be the beginning as soon as the production start, or maybe when you're sending this batch information, we didn't realize that, oh, it's a different product, allergens are different. That's why line clearance is very important here. That's why verification of your allergen labels are very important. Make sure you are working with R&D team here if they're coming with the new products, if they're coming with the new allergens, right? So it's being reflected in your hazard analysis, in your HACCP, and it is also being reflected all the way to the labeling, which is in your production, and they're packing labeling. I worked in the nut industry. Of course, there's nuts, almonds, pistachios, walnuts are allergens, and most of the time you will be surprised that when it comes to labeling, not many. As in general, it's just that it could be overseeing. It's just that we didn't realize. Batch was just finished, and another batch came, and then the labels were not accurate, and it went all the way until shipping, which is a good thing because we still caught it as a shipping. But if it is gone, then of course we know what is the right corrective action for that, right? So it's really important to understand this is just not QA role. This is not just R&D role, and we just gonna say, well, it was production job, production responsibility to make sure the labels were accurate. I think that is it's a teamwork. We just cannot just say, you know what, while you were placing labels, so that was your responsibility. Production might say, well, it was QA job. You guys didn't do that. And it's more like blame game than actually helping us, in terms of team. The goal is same. Goal is everybody's goal is to make sure food is safe for our consumers. So in this, right here, when I'm talking about allergen control, a lot of companies may have a color code policy also, right? That white color of bin or the could be the tools are for male, red color could be for someone else, something else. So if that's what you're doing, please do make sure that it's working throughout. We are not, a lot of people basically come up with so many colors, and now color code policy is actually really not working, but backfiring because it's so complicated. Okay, so verification of allergen control is very important, especially if you're dealing with allergens. Make sure that you do check records. Make sure employees are well trained also. Okay, if you are the one who is responsible for printing the labels. If you're going to on the floor, please make sure that you basically take away extra labels out from their site, from the floor, so we don't have this scenario where we are basically placing the wrong labels. Sanitation program. I'm pretty sure most of you have gone through or working or have worked in terms of validation and verification of sanitation program. This is another topic, another prereq program to talk about, another very important department where we need to do validation and verifications. Okay, in the validation we are looking at in terms of sanitation, we're talking about clearly defining the objective of eliminating microbial contamination, right? What is your established criteria for acceptable microbial level? Now, these criteria can be based on your regulatory requirement. It could be industry, it could be your own quality, internal, and safety standards. So, with thorough documentation of cleaning methods, including equipment assembly and cleaning agent concentration, identifying, prioritizing your potential hazard. Is it microbial contamination? Is it cross contamination? Through a comprehensive risk assessment. Execute documented procedure. Make sure that's why you have master sanitation program, right? SSOPs, use procedures, ensuring proper cleaning of all food contact surfaces and equipment. conducting microbial testing on surfaces before and after cleaning to validate your microbial load reduction, regularly verifying adherence through visual inspection. It could be ensuring no visual residue post cleaning, periodic review of documentation to ensure it remains up to date, reflects current practices. You can regularly assess and document employee training also to ensure competency in your sanitation procedures, and use validation to identify areas of improvement such as cleaning frequencies or methods. So that's in your validation. And visual inspection, example, regular inspection, identifying visual residue, corrective actions are taken promptly. Post cleaning ATP swabbing to ensure surfaces meet cleanliness standard. Periodic sampling validates your microbial counts on food contact surfaces. Regular checks perform proper segregation to prevent cross contamination. These are all part of your verification, where you do regular audits, regular checks. You're also making sure that your training records, you're also making sure your staff is competent. You're looking at regular calibration of your dispensers, accurate cleaning solutions, and then you can also do quarterly review of your records to validate consistent execution of your sanitation activities. Like I said, this is another area where we typically get really confused. We don't know exactly what sanitation is in terms of validation, in terms of verification. Many companies they might they might choose different ways of validation and verification. But sanitation department makes sure you do have SSOPs, your procedures lined up, what will be the right validation method for you, and how will you be conducting the verification activities. Environmental monitoring program is another one which is a vital verification tool to ensure facility and equipment is properly cleaned and maintained. In the environmental monitoring program, you might divide by zone 1, zone 2, zone 3, zone 4, and you might test zone 1, which is product contact surfaces, zone 2 is adjacent, and zone 3 still in the same room but a little bit further down, and you have zone 4, which is again outside, maybe the hallway, it could be break room. So when you're talking about environmental monitoring, you are actually assessing your environment. A lot of people get confused this with, finished product testing and we don't have to do environmental monitoring program. That is not the right way to look at this program at all. When you're taking the swabs, make sure that when you're creating this program, are you going to be checking the pathogens, or are you looking for indicator organisms? Are you doing allergen testing in there? Is it air water testing also included? ATP swab, direct observations of swabbing, and trend analysis. And this is another area where procedures are not really good or deep enough, meaning it's not well laid out. Most of the time, technicians are taking swabs, and those swabs are already contaminated because the way they handle it. Okay, that's why you could be getting a lot of false positives because the way they are handling it, the way they are touching the swabs, right? What is the right procedure? How you want to, first of all, the locations. What locations are you going to be taking the swabs from? Okay, rotation meaning frequency. Is it every week, every day, every month? Okay, how many swabs? And who is really looking into those results? Because I have personally seen this where team gets results and the person who's responsible didn't even know how to interpret those results. So maybe they are not, maybe they should not be getting those results because lab is just going to tell you positive, negative, right? Lab is just going to mention the E. coli is 10,000 CFU per milliliter or gram, right? Whatever that unit is. So they're not going to interpret for you, agree? You have to make sure, you have to understand what that result means to us, okay? What does that even mean to our product, our environment, and are we taking any action, meaning corrective action? What was the root cause? Now, your procedure might say that you are actually going, if once you get positive, you will be getting 3 negative results before you start production. And many times, facilities get 1 positive, they clean it, they took another swab, they get negative, and they resume back. So they deviate their own procedures, they deviate their own SOPs. Okay, and this is not a really good indicator because you want to make sure that it's not about for your convenience. Let's not follow the SOP, but SOP really gonna have to look like good for the auditing purposes, and that's not the idea here. Okay, so when you're talking about environmental monitoring, please make sure that procedures are well laid out. When you're talking about the technicians who will be taking the samples, make sure they are well trained. Okay, making sure that everybody understands what is the purpose of this program, what the data is driving, what data is telling us, and are we really improving? Okay, and please do not forget the corrective actions. Improving validation and verification. So initial validation can be done over a period of first 90 days of a new or revised food safety hazard system. Okay, check back to see if it is working. Verification activities are used to revalidate, meaning demonstration of your accuracy. Okay, use multiple strategies to ensure adequacy of your initial, ongoing validation and verification. Use worst case scenarios or conditions when challenging your program. Root cause analysis, corrective and preventive actions. So if not done effectively, the result could be CCP deviations, non-conforming product, which could result into recall also, right? Or it could be that a complete system breakdown, right? Because we did not check back, we did not see that, we forgot. It could be many things. A lot of things are going on, meaning in terms of it could be management changes, it could be we are going too fast and we are not really checking. And now we are in a situation where it could be a customer complaint. It could be that recall scenario. So it's very important to understand. And again, this is HACCP team. You have HACCP team leader, senior management. They need to all come together and say, you know what, look at holistically here. Okay, what are we really doing here? What is our validation going to look like? Verification. Whenever and communication is the key here. Are we really communicating to the right team members here? Are we even including them? Okay. When we're talking about whether it's a HACCP or any kind of validation verification that when we're performing, are we even improving and are we including the right team members? So this is just an example I wanted to put. So I think because it's in a simple way to explain both validation and verification. Validation without verification. For example, while hand washing with soap is a scientifically proven method for effectively removing dirt and grime from your hands, its validity becomes negligible if there is no verification in place. If employees do not actively engage in hand washing practices, the efficacy of this well-established strategy loses its significance. And verification without validation. Washing hand soap is not a proper way to clean them, even if a manager checks that people are washing their hands. It doesn't make a difference because washing without soap is not the correct way to clean hands. So I hope, again, these two terms are very heavy. It takes a lot of time to understand what is validation, what is verification, what comes first. And I tried to simplify in using this example in terms of validation and verification. So in summary, validation is again, it's very important and crucial in ensuring your safety and quality of your food product. By validating the process, it could be cooking, it could be pasteurizing, it could or sanitation method. We ensure that processes consistently eliminate or reduce potential hazard to acceptable levels. And in verification, it is playing a key role in maintaining the effectiveness of validated processes over time. Regular check, monitoring helps. It basically helps in confirming the established procedures you have is going to continue to be followed, preventing deviations that could compromise food safety and quality. And of course, it acts like continuous insurance mechanism, providing confidence in an ongoing reliability for the processes. Going back to this validation, it could be cooking, time, temperature, okay, pasteurizing, sanitation method, whatever method are you using to reduce or eliminate food safety potential hazards to acceptable level, and that is basically it's a validation, and verification is going back and basically making sure that the validated process is working, it's being maintained, we are not deviating, somebody is actually monitoring because sometimes It could be that again, for many reasons, we didn't notice, we didn't look at it, and now we have a lot of deviations going on. In a lot of processes, there's a siren, it automatically shuts down and basically gives the message on the screens also that is being CCPs are being violated, being deviated. So example again, validation is food safety manager collects scientific research to demonstrate that the cooking temperature used in the recipe is effective in eliminating harmful bacteria. Okay, and verification is a manager in the cookie factory review production records to maintain or to confirm that cookies were baked at the temperature described in the recipe. So exactly, validation is will it work, verification is did it work. Okay, it is a continuous cycle. Okay, in terms of validation, verification. So just to give you SVS a little bit again, we do have environment monitoring program is exciting. Self-paced programs. We have a bunch of library of courses coming up with the short courses. If you guys are interested, you guys are more than welcome to visit our website and look at our self-paced courses, which is again interactive, engaging. It will increase your competency, and of course, they're self-paced. And we have risk assessment as well, and many other topics. So with that said, thank you. I know there was an audio issues, echo issues. I apologize for that. I'm gonna make sure next time we're gonna check back again to make sure there's no audio issues. And I hope you guys enjoyed, learned. Simon, we can take some questions.
Yep, thanks very much, Hami. Yeah, there was some audio issues. I think I don't know if it was the actual microphone or the echo of the room, but we made it through the best we can.
Yes,
and,
yeah.
Everybody will get a copy of the slide deck and the recording as well. But there are lots of questions. So first one from Sharon. Is allergen data and determination based simply on countries or states?
Sharon, allergen, typically what we look into, if I'm in US, of course, I'm going to be more concerned with my top 9 allergens. But if I am doing the exporting to, let's say, Europe, for example, right, then I have to consider because it's country of sale as well. So when we're looking at data, it's also about the country where you sell it. Who is your consumer there? If my consumer is US based, then I'm just looking at top 9 allergens, right? But if I have Middle East, for example, Asia market, probably it could be Europe also, then yes, then I am looking into that because again, allergen labels are important, and if labels are not there, it could be that the consumers in that that country could be affected, right? And again, we all know people get allergen reactions, and it could be detrimental. It could be that it's just not going to make you just sick, but people die from these things, right? So yes, so my answer is going to be that yes, please do consider where is your country of sale.
Okay. A question from Mike. How much does measurement error play in validation?
That's a good question. How much error could play in? I don't have the exact answer, but when I remember when we were looking at it, okay, when we ran many studies after probably 10 sets of it, and we said, what is the right temperature, what is the depth of this product also, the bed speed and everything. When we looked at validation, we were looking at more about in terms of what kind of log reduction we are getting. Okay. Whether we're getting 5 log reduction, is it 2 log, is it 5? We had to have 5 log because of the regulation we were in. So we were going off based on that. Okay. But I can definitely look into that as well.
Okay, question from Esperanza. How do you validate allergen cleaning effectiveness when its level is below detectable limits?
That's a really good question. We get all the time. We ask this question also all the time. How do you validate allergen cleaning effectiveness? Because after once you run allergen, a lot of people use ATP swabs, and if they have this, or it could be a laser test also when it's below the detectable limit. Um, you can run the validation, meaning okay, before and after, how much basically you had it, in terms of your numbers, and then once you clean it, what actually number you get, and you can also see effectiveness of cleaning, meaning concentration of your sanitizers probably, or the cleaning agents you have. Who is really cleaning that day? It could be uh, uh, sorry, I'm just going blank. It could be that shift one versus shift two could be another one. That why we always fail in shift two, but we are always passing shift one, right? When we clean and all. So you can validate your allergen cleaning uh, before and after. I have done that way also when I was basically taking the swabs before, and I will basically do after also and see what is my number to basically show that it's drastically, low, and that's how we show to the auditor.
Okay, thank you. Question from Guadalupe. Wait a minute, where's that gone? Don't know, it's disappeared. Question from Alabisi. Does validation come before verification in all procedures?
Does validation come before verification in all procedures? Its answer could be yes and could be no. When it comes to HACCP, when we can talk about critical limits, when we talk about uh, food safety, validation does come first. Now, sanitation could be another way where I have seen we are actually verifying, and validation is a two separate thing. When we think about verification after sanitation, okay, you know what, everything's clean. Some people do the swabs, but then question becomes, have you validated your sanitation, right? So it's not that in every scenario validation will come first before verification, but typically you want to validate first because you want to make sure that the limits you are creating, or the standards you are creating is actually will work, because verification is making sure it is working for you.
Okay, question from Mithri. How can we determine the indicator organism while evaluating the environment contamination and general manufacturing basis? Any common indicator organism?
So I used to actually do salmonella testing, and where I get that information, because, for example, like I said, you gotta look into your industry as well. What kind of product do you have? So in the company that I was working for, we knew salmonella is our concern. So I was doing more salmonella. Then I thought, why am I really looking at target? Why don't I just do indicator organism? And we started doing EHEC. And EHEC, as you all know, it's a broader, right? It basically contains other things, and we can figure out really what are we really checking here. So I moved away. So you should look into here if there is a trade associations, okay, FDA paper, okay, trade associations also, they publish a lot of papers. What pathogen is a really concern in your industry or in your product, okay? And then you basically gonna come, okay, should I test for APC, for example? Like, for example, my indicator organism was EHEC, and take it from there, okay? After I know EHEC, then I might go for a presumptive positive, right? And basically taking my next steps based on my procedure or my program. So if you're not clear, it could be that you can generate some data at least for maybe 6 months and see, like, what does your data look like? A lot of people say, well, we are new to this, we don't have enough data, and I cannot even find. And my answer is, why don't you swab, collect enough data, and then derive your decision based on that, right? If industry standards are not implemented.
Okay, thanks, Hamid. Question from Mohammed. What is the role of monitoring between validation and verification?
So the role, we're talking about two separate roles here. Validation again is slightly different than verification, right? I mean, not slightly different. I think it is different concept we're talking about. The role of validation monitoring is basically when we talk. What is monitoring? I think that's another thing when we talk about monitoring. Are we monitoring? So once you finish your validation study, for example, you came up with the time and temperature. Are we just gonna call it a day and say, you know what, that's fine? just keep running. If we don't monitor, if we don't verify based on your data, it could be visual observations, we will never find out that we are actually in these critical limits or in the right limits of what we really came up with the validation. So role it's playing, again, is it really effective in controlling our pathogens, for example? Is it reducing to an acceptable level, right? And if it is not, then you really, whatever monitoring you're doing or whether you're not, it's not really helping, it's not working because there's a gap in between. And like I said, my personal experience when I was validation is something we do forget. We don't really look back. We don't even go back unless we're doing really annual validations, make sure critical limits. But most of the time, we already get it and just keep going, keep running. And later on, sometimes we're like, oops, we deviated validation long time ago. Okay, so that's why it's important again having the right team members and really communicating to each other.
Okay, yeah. Okay, question from Edith. Is there a guideline you can use to write up a validation procedure?
Edith, I use the association again, where they have actually did the validations, and we basically use that and we pretty much mimic because we don't have pistachio board. We use the almond board to gather the data, in terms of validation, and then we basically ran in-house tests and validation studies and funny way that we already got our validation, we already got our 5 log reduction. Guess what? A gentleman comes from test committee and we failed in front of him. So we did not even pass the validation right in front of him, but before the previous tests were already going good. So we had to go back again, restart again, and until we really get the validation certificate and from the process authority. So you can of course use that as a guide to develop your own procedure.
Okay. Catherine, how do you validate a corrective action?
You don't validate corrective action, you typically go verify your corrective actions. Okay, what is corrective action? We are looking at the root cause here. What happened? What was the reason behind? What was the root cause here? Okay, and Catherine made a really good point. Majority of the times we never verify the corrective action because again we forgot, we never really did anything. A lot of things happen, and this corrective action could be meaning the root cause was still there. So you have to either verify, it could be visually, it could be data, it could be many other, again, tools that you might use, but you need to make sure, go back, is this corrective action, meaning is this problem coming back again, meaning your root cause is still not being effective, or effectiveness check. We talk about typically effectiveness check on corrective action. Did you even verify there, whether it's physically going out on the plant? Is it really helping or not, right? Or is it just, okay, I got it, and you just sign off, and the problem is still there?
Okay, thanks. Can you give an example of validation of CCPs?
Validation of CCP, metal detector is one. Pasteurizing is another one. Roasting is another one. So those are the CCPs. And then you validate again, like I said, in my scenario, we were looking at the time, temperature, we were looking in the bed depth, what is the bed of the speed of the bed, how much product depth we have, right? And we basically use those parameters as part of our validation. And then, of course, in terms of monitoring and verification, we were using those parameters to make sure we are in compliance.
Okay. Question from Mithri. Should we validate all our control measures like those which are controlled using PRPs?
Should we validate all our control measures? Answer is yes. We should look into control measures, just not because of the CCPs. If you look at control measure, of course, if you're talking about codex, or if you're looking at the FISMA, US FISMA regulations we're talking about, they are saying that you're not just eliminating, there's a preventive measures out there. Could be PRPs, for example, right? Your sanitation program, your environmental monitoring program. Those control measures are helping. So are we really looking into those programs as the validation, the verification happening? Or are we just focusing on CCPs alone?
Okay. Ying is asking, So verification is considered phase 3 of validation life cycle.
That's that's how I would see. Yes, initial validation or verification first. Then you basically look at ongoing. Then you look at corrective actions, and you basically look at your annual reassessment. So it's not about verification as the third phase. You got to think about first you're gonna finish your whole validation cycle, and then the verification cycle will come in place.
Okay. Not sure if you've covered this already. What is the role of monitoring between validation and verification?
Yes.
Yeah. Okay. Question from Miretti. What is your view on roles and responsibilities, more specific, quality versus production versus maintenance versus PTD?
PTD. I'm not sure what PTD is, but my view on role and responsibility in terms of specific quality, and I'm not sure if you're looking at just the quality, but you're looking at food safety as well, production versus maintenance. The role and responsibility they are all playing are major roles for one, but it's a teamwork. It's not about typically mindset is. I'm not saying with every company, but typically mindset is, oh, Harmeet is the QA food safety manager. BS is her problem, HQ is her problem, or any other GFSI, for example, is her issue. Okay, and rest of the team may not see that way because it's a food safety audit that she should be responsible for. But it also comes from the senior management here. What are we really role are we playing, and how are we connected to each other? What is our end goal here, right? To be compliant with the regulation, to be compliant with our third-party certifications to assure the food is safe, right? Now, many companies production actually take over quality because they feel like it's our responsibility to make sure our product is always with the highest quality, and they have taken this role away from QA. Okay, because most of the time what happens that QA or QC put product on hold, production will come back, they're gonna say, Simon, do you want to take another test? Do you want to take another sample? Because they don't want to put on hold. And again, the accountability, and I think that's the thing. Where is the accountability lies? And accountability doesn't lie just with QA, QC here or QA food safety department. Accountability lies with everyone, from the beginning to the end, from receiving to shipping. But it takes time, and again, culture comes in and a little bit off. But culture is the one which is driving all these things. It comes from the senior management.
Yeah, for sure. Martin, is it acceptable to use simulations for validation?
I'm not sure, Martin. Again, I don't know exactly your product, but simulations are not acceptable because you have to show. And maybe simulations could be for the beginning, but you have to basically go on the line, or basically you have to follow the same thing to make sure product is safe, the validation is working. So answer is in terms of my how much I know, it will not be acceptable just to use simulation, but it could be meant. It could be very different scenarios. It could be your authorities, it could be federally, you're looking at statewide, it could be your third party auditor, but simulations may not go very well, especially when you're talking about CCPs and in terms of food safety.
Okay.
You need to demonstrate. You have to demonstrate that. Sorry.
Oh, okay, thank you. A question from Samantha. Does everything within the food safety program need validation? Or if not, how do you decide? Example, does document control need to be validated?
Samantha, document control, typically we do verification, right? Not everything needs validation. For example, you said document control. What happens with the document control? We write forms, procedures, right? And then somebody, meaning if I am responsible for packing, it's my responsibility. My documents are in right order. We're doing everything, and then typically it could be going to the document control department, or it could be going to QA side of it, right? That's more on a verification we are doing. It could be right at the spot. You say, you know what? Hey, something's off here. Something's wrong here. And I'll give you a really quick example. Uh, I was at on-site doing a gap assessment, and we found this company was not really in uh, limits of their chlorine level. The document control individual, this lady, found out months later that we've been out for almost a month and nobody checked anything. Nobody verified at that spot. Nobody even raised the voice, raised the concern. We are off for 1 year. Oh, sorry, 1 month. Until I came and I said, let's look at your records. So the verification was missing there. Validation is, if you talk about, look at the competency of that employee. Employee was not even competent to do, meaning the enough training was not even there for him. So he just know I have to write this information on the form and I'm done. So there was a lot of gaps already, and again goes back to the culture. So when we talk about document control, we're looking at more terms of verification. Okay, some documents are working for your monitoring verification because again, they are straight related to food safety, CCPs. But not every document needs validation now.
Okay. Another question from Samantha. How do you determine a high-risk allergen from any other allergen, or are we considering all the legally named ones as high risk?
That's a good question, Samantha. I don't think so. We can, in my perspective, high risk or versus low risk, because if I'm allergic, I'm allergic. I'm gonna get those allergic reactions. We are considering legally as all as a high risk because you don't know your consumer. You don't know you are being proactive here. You're trying to be preventative here, right? You don't know what if consumers you think it's low, but they are actually high. So you don't want to go to that route where it's basically for all the consumers. These are the allergens. If they have it or they don't have it, that's a consumer. That's why we do the label reviews or label. They should read the labels, right? Consumers, and then they make their choice. Right? That's why label accuracy comes here. But in terms of high risk or low risk, I'm not sure how can we even determine that and how will you even control your consumers. Does that make sense?
Yeah, it does. Question from Mithri. How can we verify the glass fragments from the juice bottle if there's no x-ray available?
That's another one. But then again, your glass bottle policy, your PRPs, again, visual verifications, right? When you get receiving this packaging material, for example, this glass bottle, are we doing visual observation there, right? When we receive it. By the time we receive it, put on storage, by the time they're on the floor, are we doing another check before we even start the bottling line, right? So there are checks and balances again. There's no one answer for all the questions I see in my career so far. There's no one thing that, if we do this, done. I think again, it's about responsibility and accountability that falls under everybody's lap, whether they like it or they don't like it, but it is what it is, right?
Yeah, thank you. Bit of a long one from Francesco. Hi, really interesting presentation, thanks. My question is on validation for cleaning food contact surfaces from allergens and microorganisms. We design a program where we contaminated the surface with allergens and micro and using the worst case scenario machinery. After the cleaning, we analyze the surface. What do you think about this way of validation? What's your advice?
Now, this is an interesting one because I have never, I've never heard that. So you guys are where we contaminate the surface with allergen and micro and use the worst case scenario machinery. After the cleaning, we will analyze the surface.
Yeah.
So what do you think of this way of validation? What is your advice? So same like you're looking into sanitation, you're looking at the allergen and microbial organism for the sanitation purposes also. This could be the right way. I'm going to give a really funny example here. A lot of people think the way you validate sanitation, you go there, you spray with the alpha D2 sanitizer, and then you take the swab. And guess what? The results are always going to be zero because you are taking the swab from the clean surface, if that makes sense, right? Typically, what happens is we say, you know what, sanitation is done, let the production run for a couple of hours, then you come swab, right? When you're talking about the validation, if this is what you are looking for and you're getting the results, then you can use this way of validation. There's nothing wrong with it. Myself, I have done that too, before and after. Let the production run. I don't want to take my sanitizer and spray on it and take a swab. No wonder it's always negative. Okay, so you want to test. Also, you are really pushing your limits, and I think you're challenging your studies here. Are we getting where we want to be? Let's try, like you're doing intentionally because you want to find some stuff, right? You're not trying to hide anything. And again, during my whole experience, that I learned that most of the time we're doing sanitation swabs, we're doing this validation of allergens wrong because we just use the swabs from right or clean surfaces and they're not really getting anywhere.
Okay. Just got one more here from Guadalupe. How can I validate the allergen program internally? All allergens handled are in a sealed container. So the concern is in the event of a spill.
How do I validate all of this in sealed containers? Guadalupe, stream container. I'm not sure exactly the whole process is and how are you also receiving in the field? Are you just receiving as is and shipping as is? I'm not sure if are you really manufacturing, meaning putting. In the event of a spill, anyways, you should have a allergen spill kit that we typically talk about. You should have it in a program that in the event of a spill, what will the right tool you will be using, broom for example, or right? And then again, how will you make sure assure that there is no cross contact? Are we really keeping all the allergens on one ion? Is it above, below? In the event of a spill, what could be, again, you're looking at your risk assessment, right? So when you're doing the risk assessment, you're looking at all these scenarios and you're thinking, okay, if there is the event of a spill, what is my risk here? Okay, and if there's a risk, how are we going to manage that risk?
Okay. All right, we've run 6 minutes over, but really appreciate lots of great questions and excellent answers from you, Hami. Good job. We did have some sound problems, but we'll sort that for the next time. And I'm sure when we issue the PDF of the slides and they listen back, everybody will get a lot of great information out of it. So thanks very much for your time today. Appreciate it.
Thank you. Thank you again, and I apologize for the audio. Next time we will make sure the audio is working. And yeah, thank you for this opportunity. I hope you guys enjoyed and go food safety.
Yeah, you got another 2 later on in the year, so we look forward to them. Have a nice weekend, Hami. Thanks very much.
You guys, thank you. Thanks a lot.
Thank you. Okay, everybody, I've put the certificate download in the sidebar. We'll be following up in an hour or so with an email with the recording, a PDF of the slides and the certificate. And yeah, go to IFSQN and register for the next one. So, and have a lovely weekend, and we'll see you next week. Bye-bye.